Hello, my name is Dr. Santosh Abraham, and I work as a consultant in endocrinology in a small town near Thrissur called Karikad. Previously, I was appointed as a consultant in diabetes and endocrinology at Scarborough Hospital in the United Kingdom. What I would like to say today is what happens when your blood sugar is going up. So, sugar is basically a sticky substance. We all know that. So, when the blood becomes um, when the blood has more sugar, it means that the blood becomes more sticky and thick. So what happens if I dip my fingers into a small cup or bowl of honey? When I take away my fingers from that cup, my fingers stick together. In a similar way, when the blood sugar increases, blood becomes more sticky and thick. Suppose I cook some rice and I pour the remaining rice soup into my kitchen drain every day. What happens? So, you know that rice soup is sticky and it sticks to the walls of the drain, and in a few days, the drain will get clogged like this. So, when you pour some thick solution into your kitchen drain, like a sugary syrup or that contain too much of fat, the drain can become clogged and blocked. In the same way, when your blood contains a lot of sugar, it makes the blood cells more sticky and they may stick together to form small clots, and they also stick to the walls of the blood vessels. So when they stick to the walls of your blood vessels, it could narrow the lumen of the blood vessels, and the thick blood cannot flow in a smooth way because blood is already thick because it contains a lot of sugar, and when it gets blocked, the flow becomes very slow. And what happens when this process occurring? When the blood cells stick to the walls of your blood vessels, the police inside our body, and these are the white blood cells, are recruited there. They want to fight against this stuck blood cells, which are causing a significant, uh, you know, block to the blood flow. And in that process, they release a lot of chemicals. But these chemicals can't help to remove the stuck blood cells. Rather, they cause a lot of damage to the blood vessel wall itself. The vessel walls become thin and fragile. They easily break, in addition to the blocks they have. So, this causes a lot of anger and heat inside the blood vessels, and that's called inflammation. So, diabetes is just not your blood sugars rising above 150 or 200 or 300, but it's more than that. It's not just your blood sugar soaring up, it's a chronic inflammatory process. And hence, when we are trying to treat diabetes, we're not only decreasing your blood sugar, but we also want to decrease the inflammation so that you can lead a healthier life. So, how can we decrease the stickiness of this blood, and how can we prevent the blood from getting stuck into the vessel walls? Well, the answer is simple. If you decrease the blood sugar, then it will become thin and it won't stick to your blood vessels, and it will not cause much inflammation or anger to the blood vessels. So, if you have diabetes, just remember that by decreasing your blood sugar by any means, it won't be helpful to you in the long term. You need to also decrease the inflammation. So for that, you might need some medications when you're diagnosed with diabetes. And these medications help not only to decrease the sugar, but also decrease the inflammation. So that's the importance of starting medications as soon as you are diagnosed with diabetes. Thank you very much for watching this video.